NextStage has prepared this video as a supplement to existing labeling and training materials. It is not intended to replace the NextStage System 1 or PureFlow SL User's Guide or cartridge instructions for use. Patients, care partners, and providers must review and refer to the System 1 and PureFlow SL User's Guide and cartridge instructions for use for all instructions, warnings, and precautions. Thank you for joining me in this introduction to the NextStage PureFlow system. Watching this video and practicing with your nurse trainer should help you gain the confidence you need to use PureFlow at home. To help you understand the PureFlow system, we have divided this video into 6 sections: overview and assembly, installing and priming a pack, making a batch, using a batch, drain, final flush, and unloading the sack, and supplemental procedures. You can watch the entire video or a specific section of it by selecting one of the section titles on the screen. The PureFlow system uses your home tap water or source water to produce ultra-pure product water. The source water is purified and then mixed with dialysate concentrate in the dialysate sac to make a batch of high-purity dialysate. This replaces the need for bagged dialysate. The batch you make will be used for multiple treatments. To use PureFlow, it is helpful to understand the 5 main system components and how they go together. The 5 main components are the cabinet and tub, the pre-treatment kit, the control unit, the purification pack, and the dialysate sac. The cabinet serves as a stand for your cycler and contains the control unit and the tub. The tub slides in and out and holds the dialysate. This is the pre-treatment kit. It consists of the sediment filter, the mounting bracket which contains the air vent and water pressure regulator, the source water inlet line, the drain line, the source water connections, and the instructions for use. This is the control unit. It is the brains of the system because it constantly monitors the quality of the product water and dialysate and the functionality of the system components. This is the pack. This disposable unit filters and purifies your source water. This part is called the sac. The sac is a disposable bag that contains liquid dialysate concentrate and includes fluid lines for connection to the pack, the control unit, and the cartridge. Now that we've covered the 5 main components, let's talk about how we put them together and use them for treatment. Before you begin, you need to find a good location that has access to an electrical outlet, to your water source, and to a drain. Remember, the water and drain lines are each 40 feet long, but the power cord is only 6 feet long. Keep in mind that during installation, there needs to be room to access the back of the cabinet to make all of the necessary connections. Also, remember to place the lines in the power cord safely out of the way of foot traffic. Our first task is to install the control unit. Slide the control unit completely into the cabinet shelf. Once the control unit is in the cabinet, pull the tub out slightly so you can get to the thumb screws located below the control panel. Now, manually tighten the 2 thumb screws. Next, we need to install the pre-treatment unit bracket on the back of the PureFlow. To do that, you'll need to slightly loosen the 2 screws on the back of the cabinet using a Phillips head screwdriver. Now, take the bracket and slide it down onto the 2 screws. Press down firmly to seat it in place, then tighten the screws. Next, we're going to open the air vent, which will allow air in the water lines to escape. You do this by turning the black air valve clockwise until it stops, then counterclockwise by half a turn. While we're here, notice the water pressure regulator on the left side of the bracket. This comes preset and does not need to be adjusted. Now we're ready to attach the sediment filter. Since this filter needs to be changed yearly, it's helpful to take a minute now to label it with the date it was installed. Remove the yellow cap from the top of the sediment filter. Next, screw the filter into the filter head, turning clockwise until it's tight. Next, we need to connect the blue water line coming from the pre-treatment unit to the water inlet on the back of the control unit. Now, locate the short UV light water line and connect it to the water outlet, just above the water inlet. Now, locate the 40-foot black drain line and connect it to the back of the control unit, at the drain line connection. When you connect these three lines correctly, you should feel them snap easily into place. At this point, you can position and secure the end of the drain line into your drain. It should not be submerged in water. Also, remember that the drain line must stay in position at all times during PureFlow use. There are three options for connecting PureFlow to your home water source. Option A is a standard faucet adapter. This piece connects your PureFlow unit directly to most sink faucets. Option B is an under-sink adapter. This option connects directly into the cold water line underneath the sink. You may need a plumber to install this option. Option C connects a washing machine hookup using a Y splitter, which can be found at your local hardware store. Now we're ready to connect the 40-foot blue water line to your water source. Once it's connected, turn on your cold water and make sure to check for leaks. The next step in our process is to make the 5 electrical and data connections on the back of the control unit. Don't worry, each one of the cords or cables has a unique connection, and only one mating connector will fit. First, make sure your cycler's power cord is plugged in. Second, connect the short interconnect power cord from the cycler to the control unit. Third, connect the heater power cord from the back of the tub to the control unit. Next, connect the cable labeled J2, which comes from the cabinet, to the control unit. Then, connect the cable labeled J1, which comes from the UV light, to the control unit. Finally, insert the light gray USB cable into the back of the control unit and connect it to the cycler jewel box or connects box on the back of the cycler. Congratulations! You are now finished assembling the PureFlow control unit and pre-treatment kit. You are now ready to learn how to install and prime a new pack. This is the purification pack, or pack for short. Its job is to purify your source water to create ultra-pure water for dialysate. Before a purification pack can be used for the first time, you need to prime it. Priming takes about 2.5 hours. First, check to be sure that your cold source water is on. Then, turn on the PureFlow power switch. You should now see the software version displayed on the control panel. The PureFlow system will now be in standby mode. Remove the control unit adapter package from the outside of the pack and set it aside. Open the perforated section of the pack by pulling on the corrugated finger tab. Tear off the perforated flap. This will expose the pack connection lines. Lift the pack using the white plastic strap on the top and slide it into the pack compartment. Leave both of the white plastic straps on the pack for future use. Next, remove the paper tab and extend the 3 lines coming from the pack. The electrical cable, which looks similar to a telephone cord, connects to the control unit inside of the pack compartment. The connection point for this cable is angled slightly and may be easier to reach with your left hand. With the locking side of the tab facing down, feel for the connection point and insert the tab until it clicks into place. Next, take the pack water inlet line, the line with the white elbow connection, and push it into the water outlet connection on the control panel, the one with the white circle around it. The connection is white to white, and you'll hear a click when it is properly connected. Last, remove the cap from the pack water outlet line, that is the line with the blue clamps, and carefully connect it to the conductivity sensor connection, the one with the orange circle, and turn to tighten. This blue to orange connection is made only for priming a pack. When you begin making a batch, you'll be connecting the pack water outlet line to the sack. Now you are ready to start priming the pack by pressing Go on the control panel. At this point, the control panel will ask if you want to prime a new pack. Press Go again to confirm that you do want to prime a new pack. The time remaining for priming the pack will be displayed on the control panel. As a reminder, your cold source water and power must remain on during the entire priming process. Lastly, connect the control unit adapter you set aside previously to the waistline connector on the front of the control unit. This connection is indicated by a yellow circle. Be careful not to pinch the lines in the door as you close it. Once prime is complete, the control panel will tell you to close the blue clamps. Go ahead and close both of the blue clamps on the pack water outlet line, including the blue non-reopening clamp. Press Go to confirm that you have closed the blue clamps. The control panel will change to standby mode. Congratulations! You have now completed priming a pack. Like any filter, the pack has a limited lifespan and will periodically need to be replaced. How often depends on the quality of your source water. The PureFlow control panel notifies you when a pack either expires or becomes exhausted by displaying a caution or alarm. Just follow this same procedure to install and prime a new pack. Now you will learn how to make a batch of dialysate. It will take approximately 7 hours to make a 60-liter batch of dialysate. If you are using a smaller sack type, for example a 40 or 50-liter sack, the process will take less time. Once you have started making a batch, the control panel will display the time remaining for completion. Remember, the batch must be used within 72 hours of the time you started making it. Verify that the sack expiration date has not passed and that the sack type matches your prescription. If your sack type is correct, remove the sack from the packaging, keeping it folded. Place it on a flat surface and gently press on the bag to check for leaks. To make a batch, ensure that the control panel reads Standby, no batch. Now press Go. The default display will read Open Door, Load Sack. It is especially important to check the sack type setting prior to making a batch if you have recently received a replacement control unit from NextStage, since the replacement control unit will have a default setting which may not match your sack type. If the sack type on the control panel does not match your prescription, press and hold Stop to return to standby. Refer to the Supplemental Procedures section of this video for instructions on changing your sack type. Next, place the sack in the center of the tub with a label facing up and slide it to the back wall. Unfold the flaps toward the front and back walls to expose the lines. Remove and discard the protective foam sheet. Next, remove the paper tab holding the lines and uncoil them. Pull open the control panel door and lift up the dialysate pump cover. Snap the 5-way connector and elbow joint into the retaining clips. The dialysate pump tubing The thicker tubing must be pointing to the right. Thread the tubing through the pump and route the remaining lines within their respective channels. Now you can close the dialysate pump cover and the control panel door. If the door does not close easily, check that the tubing lines are properly routed. Once the control panel door has been shut for 2 seconds, the display will read "SAC loaded, connect lines." Now you need to pull the lines on either side of the green tubing to release the kink in the line. Next, slide the tubing collars down over the creases. Now we are ready to connect the pack to the sack. At this point in the process, it is very important to use aseptic technique. Since you've just primed a new pack, you'll first need to disconnect the pack water outlet line from the orange conductivity sensor on the control unit. Now we'll make the blue to blue connection. To start, disconnect the short protective segment on the pack outlet line. That is the one with the blue non-reopening clamp. Next, remove the end cap from the water inlet line on your new sack and connect the two lines together. Make sure to tighten the blue rotating collar and then remove the connector tab from the sack line. Now unclamp the blue clamp on the pack line and drape the sack line into the tub. Now we're going to make the orange to orange connection. To do that, take the sack conductivity line with the orange clamp, remove the cap, and connect it to the orange conductivity sensor by turning it clockwise. Make sure not to over-tighten the connection. Once these connections have been made, make sure that all of the clamps are unclamped and that the connections are secure. Slide in the tub and close the cabinet door, making sure that the tubing isn't pinched. The control panel will now say "Connect lines." Press Go to confirm that the lines have been connected. The system will now begin making a batch. PureFlow will automatically perform a series of self-tests just before water begins filling the sack. You may hear a mechanical noise when the pump starts. The control panel will now read "Making batch." Your PureFlow system's heater warms the dialysate for your comfort. You can adjust the temperature on a scale of 0 to 20. Press the up or down arrow to view the current setting. The heater is preset to 10, which is a comfortable temperature for most dialyzers. However, if you feel you need to adjust the heater setting, refer to your user's guide for instructions. Once the batch is made, the system will perform an automatic conductivity check. After that, the display panel will read "Check chloramines. Remove orange line." The system does this because, for each new batch of dialysate you make, you must test the product water for chloramines and chlorine. We recommend testing within 2 hours of making your batch. Chloramine and chlorine test kits vary, so be sure to use your dialysis center's recommended testing kit. To obtain a product water sample for chloramines and chlorine testing, disconnect the orange line and hold it over a specimen cup. Press Go to dispense the volume of water you need for testing. There might be a delay of about a minute before the system dispenses the product water sample. This is normal. After the sample is dispensed, the control panel will say "Check chloramines, reconnect line." Go ahead and reconnect the conductivity line. Now you can test the water sample for chloramines and chlorine using your test kit. In order to use the batch, the test result must be a concentration less than or equal to 0.1 parts per million. If the water sample passed the test, press Go. If it failed, press Stop. Our sample passed, so our batch is now ready to be used. The control panel will display the time remaining until the batch expires. If the sample test fails, or if your test kit requires more than 60 milliliters of product water, press stop and repeat the procedure to either retest the sample with a new test strip or obtain more product water for your test kit. If the second test fails, the batch must be drained and the pack must be replaced. Do not use the batch. Instead, use bag dialysate for your treatments until you can prime a new pack and make a new batch of dialysate. Now we will show you how to use the batch for a treatment. At this point, you should have already primed your cartridge and entered your treatment settings into the cycler. To prepare the PureFlow system to deliver the new batch of dialysate for your treatment, press Go. The display will read Config to use batch. Press Go again. The control panel will now display Batch in use. Now you're ready to connect the sack to the primed cartridge. Remember to use aseptic technique when making these connections. First, wash your hands and put on clean gloves. Then clamp the green clamp next to the small white filter on the sack outlet line. Now let's make the white to white connection. Clamp the white clamp on the cartridge saline line and the green clamp on the cartridge dialysate inlet line. Disconnect the lines. Remember to keep the ends of both lines sterile using aseptic technique. Next, connect the saline line to the saline tee and leave both white clamps closed. Now we'll make the green to green connection. We do that by connecting the sack dialysate outlet line to the cartridge dialysate inlet line. Then unclamp both green clamps. You'll be using a new dialysate outlet for each treatment. Finally, let's make the yellow to yellow connection. Clamp and disconnect the waste line from the priming spike and connect it to the control unit adapter. Now be sure that both clamps are open. Congratulations! You are now ready to start your treatment. After making your vascular access connections and confirming that you are ready to start treatment, press the treatment key on the cycler. You are now in treatment mode. Once your treatment has ended and rinse back is complete, press Stop on the PureFlow control panel to pause the batch. To disconnect the sack from the cartridge, close the green clamp below the white filter on the dialysate outlet line. Then the green clamp on the dialysate inlet line, and lastly, the green non-reopening clamp. Now disconnect the sack dialysate outlet line from the cartridge. Once closed, the green non-reopening clamp permanently closes this line so it cannot be reused, since it's no longer sterile. Clamp the yellow clamps on the waste line and the control unit adapter and disconnect them. Now let's learn how to drain a batch, complete the final flush of the control unit, and unload a used sack. Before you begin draining, check again to be sure the drain line is positioned in a drain and your cold source water is on. Now press and hold stop for 3 seconds until the display reads Batch in use. Continue Go to drain stop. Press stop. The screen will read Drain Pending. When Drain Pending is displayed, PureFlow has not yet started to drain. When you are ready to drain the sack, press Go. Once you start to drain the sack, you cannot go back to using the batch. PureFlow assumes a full 60-liter batch needs to be drained, which will take approximately 3.5 hours. If there is not enough dialysate for another treatment, or if the batch will expire before the end of your next treatment, the batch must be drained. In fact, the system will not allow you to use a batch that's expired, even if it expires during the course of your treatment. If there's only a small amount of dialysate to drain, or if the sack is almost empty, you may stop the drain mode before you see Drain Complete on the display screen by pressing stop to pause the batch, and then pressing and holding stop again to end the drain. Once draining is complete, the control panel will read "Drain complete" and ask you if you want to continue or stop the drain mode. Press stop. The control panel will display "Drain flushing," indicating that the final flush is occurring. This flush will take approximately 2 minutes. The final flush must be completed prior to unloading the sack, so don't try to skip this step. When the final flush is complete, the control unit will read "Unload, close blue clamps." Now you are ready to close the 3 blue clamps on the water inlet lines connecting the pack to the sack. Disconnect the sack water inlet line from the pack water outlet line, leaving in place the short segment with the blue non-reopening clamp as a protective cap to prevent contamination. Clamp and disconnect the conductivity sensor line with the orange clamp from the control unit. Now we can unload the sack. Press Go. The control panel will read "Unload, open door, remove sack." Open the control panel door in the dialysate pump cover. Next, remove the tubing from the control panel and then close the dialysate pump cover and the control panel door. PureFlow will return to standby mode and is ready to make a new batch. You can remove and discard the sack. Let's learn about 2 common supplemental procedures. The first is how to change the dialysate sack type. You will need to use this procedure if your prescription changes or if you've received a replacement control unit from NextStage. To change the sack type, PureFlow must be in standby mode. From standby, press and hold the down arrow to go to User Maintenance. Press Go to enter settings. Press Go to enter Change Sack Type. Press the up or down arrow to select the sack type. Then press Go. Press and hold Stop until PureFlow starts the self-test. After the self-test, PureFlow returns to standby mode and registers the new sack type. The second common supplemental procedure you need to know about is how to flush the drain line. The drain line should be flushed monthly or more often as needed to prevent alarms. You should perform this procedure while the PureFlow is in standby, or you may be instructed to do this in order to recover from an alarm. Fill a 60 milliliter syringe or 2 30 milliliter syringes with a 1 to 10 bleach solution. Attach a recirculation connector, otherwise known as a female-female adapter, to the syringe and then connect it to the yellow waistline connector on the control unit. Push the 60 milliliters of bleach solution into the waistline connector. Allow the solution to stay in the waistline for 5 to 10 minutes. Do not remove the syringe. Now refill the syringe, this time with 60 milliliters of tap water, and reconnect it to the waistline connector. Push the tap water into the waistline connector. Now refill the syringe with another 60 milliliters of tap water and repeat the flush. Thank you for joining us. We realize that there are many steps to master in order to use PureFlow properly. However, with practice, these steps will get easier and become almost second nature. We hope that this video has helped you learn about PureFlow. Please watch it again anytime you have questions or just need a review.